Hello everyone, my name is Samantha. My presentation is on birthing in the United States compared to birthing in South Sudan. Some of the topics I'm going to address during this presentation are the history of childbirth, the progression in the countries, some socio-cultural factors when it comes to women in these countries, and some physical emotional effects of childbirth in both of the countries. So I want to start off by giving a little introduction. Birthing is a very important and transformative event in a woman's life, affecting her physical, emotional, and psychological well-being. Birthing is a complex and multifaceted event that has the potential to shape a woman's life in many ways. It is essential women receive the care and support they need during this critical time to promote healthy outcomes for both themselves and their newborns. So I'm going to start off with some birthing history in the U.S. During the colonial period, childbirth was very difficult and primarily managed by midwives. There were few doctors in the colonies, and midwives had more experience with childbirth. Midwives were typically older women who had themselves given birth many times and had gained experience and knowledge through attending other women in childbirth. During this time, pain relief was limited, and women were often given herbal remedies such as tea or tinctures to help them relax or to relieve pain. However, a lot of the time these remedies were not always effective, and many women would have experienced significant pain during childbirth. Overall, childbirth in colonial times was considered a normal and natural event that was managed by experienced midwives within the home with limited medical interventions or pain relief. Maternal and infant mortality rates were relatively high at the time, and many women would have experienced difficult or complicated deliveries. And I'm going to talk about the rise of obstetrics. In the United States, this can be traced back to the 19th century when advances in medical knowledge and technology allowed for more sophisticated understanding and management of childbirth. Prior to this time, childbirth was largely managed by midwives and often took place at home. In the early 19th century, obstetrics began to emerge as a distinct medical specialty, with physicians increasingly taking over the role of managing childbirth. This was driven in part by concerns about maternal mortality rates, which were high at the time. Obstetricians sought to reduce the risk of maternal death by using interventions such as forceps, episiotomy, and cesarean section. As the 20th century dawned, the medicalization of childbirth continued to accelerate, with obstetricians becoming the primary providers of maternal care. This was facilitated by a growing network of hospitals and the development of new technologies, such as fetal monitors and ultrasounds. The natural childbirth movement. In the United States, this emerged in the 1960s and 1970s as a response to the medicalization of childbirth that had become common in the early 20th century. The movement was led by a number of advocates, including midwives, obstetricians, and feminist activists, who sought to give women more control and autonomy over their birth experiences. The natural childbirth movement also emphasized the importance of informed decision-making and the need for women to have access to accurate information about their birth options. Many advocates argued that the medical establishment had historically been paternalistic and had not given women enough say in their own birth experiences. Now to compare, I'm going to be talking about childbirth history in South Sudan, starting with traditional birthing practices, which in South Sudan are very diverse. There are over 60 different ethnic groups in the country, each with their own unique customs and beliefs surrounding childbirth. However, there are some common themes that are present across many of these practices. In many communities, childbirth is considered a community event, and women are typically attended by a group of female relatives and friends during labor and delivery. These attendants may provide emotional support, help with household chores, and offer guidance and advice to the mother. Men are usually excluded from the birthing process and may spend time outside or in another part of the home. The use of herbal remedies and traditional medicine is also common during childbirth in South Sudan. These may include herbs, oils, and other natural remedies that are used to ease pain, promote healing, and prevent infections. Traditional birth attendants, who are often older women with experience in childbirth, may also provide guidance on positions and movements that can help facilitate labor and delivery. With the influence of Western medicine to South Sudan, it began during the colonial period when the country was ruled by the British and other European powers. During this time, Western medical practices and facilities were established in major urban centers, and Western-trained doctors and nurses were brought in to provide medical care. Following the country's independence in 1956, The government of South Sudan continued to invest in Western-style medical facilities and personnel. Although progress was hampered by a lack of resources and ongoing conflicts within the country, during the long civil war that began in the 1980s and continued into 2005, much of the country's infrastructure was destroyed, including medical facilities and equipment. Since the signing of the Comprehensive Peace Agreement in 2005, efforts have been made to rebuild the country's healthcare system and to increase medical care. This has included investment in training programs for doctors and nurses, as well as the construction of new medical facilities and the procurement of new equipment. However, despite these efforts, access to medical care remains limited in many parts of the country, particularly in rural areas. Traditional practices and beliefs continue to play an important role in many communities, and some people are hesitant to seek Western-style medical care due to their traditional beliefs. And the ongoing conflict and displacement in South Sudan have also contributed to the lack of maternal health care in the country. Many healthcare facilities have been damaged or destroyed, and healthcare workers have been forced to flee the country. Women who are displaced may also face additional challenges in accessing medical care due to the disruption of their lives and the lack of available resources. Efforts are being made to improve maternal health care in South Sudan, including training and deploying more skilled birth attendants, increasing access to emergency obstetric care, and promoting community education on safe birthing practices. However, much more needs to be done to address the underlying causes of the lack of maternal health care in the country, including the ongoing conflict, poverty, and gender inequality in South Sudan. So we talked about the history of childbirth in the U.S., but what progression has been made in regards to childbirth? There has been advancements in medical technology making birth a lot safer, such as anesthesia being a huge one, which is used during childbirth to help manage pain and make the birthing process more comfortable for the mother. There are a few different types of anesthesia that may be used during childbirth, including epidurals, spinal blocks, and general anesthesia. Epidurals are the most common type of anesthesia used during childbirth, and they involve the injection of a local anesthetic into the space around the spinal cord, which numbs the lower half of the body and helps manage pain during labor and delivery. Epidurals can also be used during a C-section surgery. In recent years, there's also been a growing interest in alternative birth settings, such as birthing centers in the United States. This is what a typical birthing center will look like. Birthing centers are facilities that provide a more home-like setting for childbirth, with a goal for a more natural and family-centered approach to maternity care. One reason this interest has grown so much is that women feel that medicalized environments such as a hospital can be impersonal and may not meet their personal needs and preferences for childbirth. Birthing centers are often a more relaxed and home-like setting, with options for natural pain management techniques such as water immersion and relaxation exercises, and the use of midwives and doulas as primary care providers, which some women do prefer. There's also been the goal of informed decision-making, which is to empower women to make informed decisions about their care based on their own values, preferences, and medical history. It also encourages women to ask questions and have open discussion with their healthcare providers in order to ensure that they understand the potential risk and benefits of different interventions and can make decisions that are right for themselves and their families. Informed decision-making is important because it can help reduce the risk of unnecessary interventions and complications during childbirth, while also promoting positive outcomes for both mother and the baby. It can also help ensure that women have a more satisfying and positive childbirth experience, which can have long-term benefits for maternal and infant health. Healthcare providers play an important role in promoting informed decision-making by providing accurate and unbiased information, encouraging questions and open discussions, and respecting the autonomy and decision-making abilities of the patients. By working together with their healthcare providers, women can make informed decisions about their healthcare during pregnancy and childbirth, and will overall feel more confident and empowered as they navigate this important life event. Now, what progression has been made in South Sudan when it comes to childbirth? In recent years, there have been some progress in improving access to maternal health care and reducing maternal mortality rates in South Sudan. And by doing things such as training and deploying more skilled birth attendants, South Sudan has prioritized the training and employment of midwives and other skilled birth attendants in order to improve the quality of care for pregnant women and reduce the risk of complications during childbirth. This includes providing training on emergency obstetric care and improving access to essential medical supplies and equipment. They're also trying to improve infrastructure and facilities. South Sudan has been working to improve the quality and accessibility of healthcare facilities in order to provide better care for pregnant women. This includes building new health clinics and upgrading existing ones, as well as improving access to clean water and sanitation. Increasing community engagement and education in South Sudan has been working around maternal health care with a focus on improving awareness of the importance of prenatal care and increasing support for pregnant women. This includes engaging community leaders, women's groups, and other stakeholders in advocacy efforts, and increasing access to information about maternal health through radio programs and other communication channels. Despite these efforts, significant challenges remain in addressing the issue of maternal mortality in South Sudan. Conflicts and insecurity in some parts of the country, as well as economic and logistical challenges, continue to make it difficult to provide adequate maternal health care for women. However, the progress that has been made in recent years suggests that there is hope for continued improvement in the future, as long as necessary resources and support are made available. So, to give some statistics on morbidity and mortality rates, for the United States in 2020, the maternal mortality rate in the U.S. was 24 deaths per 100,000 live births, more than 3 times the rate in most other high-income countries. The U.S. mortality rate is high for a high-income country, meaning like a country like the U.S. shouldn't really have that kind of mortality rate. And for South Sudan, maternal mortality ratio stands at 789 per 100,000 live births, whereas neonatal and under 5 mortality rates are 39.3 and 99.2 per 1,000 births respectively. And I took this from the World Health Organization. So, what are some physical, emotional, and social effects for women when it comes to childbirth? Childbirth can have a wide range of physical and emotional effects for women, such as pain. Childbirth, during labor and delivery, women experience all types of pain, contractions, back pain, and pressure. Fatigue. Giving birth can be exhausting, and many women experience fatigue during and after labor. Postpartum bleeding. After giving birth, many women experience this, or even discharge, which can last for several weeks. Physical changes. Childbirth can cause all these changes to women's bodies, such as stretching of the vaginal canal, pelvic floor muscles, and possible tearing. And hormonal changes. During and after childbirth, women may experience hormonal changes that can affect their emotions and mood. Some of the common emotional effects of childbirth include anxiety. Many women experience anxiety during pregnancy and childbirth, especially if they are first-time mothers. Depression. Postpartum depression is a common condition that often affects some women after giving birth. It can cause feelings of sadness, hopelessness, and lack of interest in activities. Many women also experience a strong bond with their baby after giving birth, which can be both rewarding and emotionally challenging. Changes in relationships. The birth of a child can also affect a woman's relationships with their partner, family, and friends. Self-esteem can be affected during childbirth, especially if there are physical changes to her body or complications during childbirth. It is important for women to receive support during and after childbirth, both from healthcare providers and from family and friends. This can help minimize the physical and emotional effects of childbirth and promote a positive experience for both mother and the baby. When it comes to stigma and discrimination related to their pregnancy or childbirth experiences, such as judgment for giving birth at a certain age or having a medical condition that affects their pregnancy, I really think this is a stigma that should disappear because childbirth is something so complicated that women shouldn't have to go through stigma because of it. So some relevant demographics are in the U.S. in 2021, percent of women aged 18 and over in fair or poor health was 13.9%. I took this from the CDC. And for South Sudan, 51.5% of women aged 20 to 24 years old who were married or in a union before age 18, which basically means, they're married. And this is from the United Nations of Women. Some political demographics. 25 of 100 seats in the U.S. Senate are taken up by women. And in South Sudan, as of February 2021, 28.5% of seats in parliament were held by women. Took this from the United Nations of Women and from the Center for American Women in Politics. To give some religious demographics, in the United States, women are 75% Christian, 2% Jewish, 1% Buddhist, and unaffiliated religious nuns, 19%. And this is from the Pew Research Center. And in South Sudan, the population is 60.5% Christian, 32.9% follow traditional African religion, and 6.2% are Muslim, and 0.4% are considered other. So there are several social and cultural factors that can affect the pregnancy and childbirth experiences of women in the United States. Some of these factors include race and ethnicity. Women of different races and ethnicities may have different experiences with pregnancy and childbirth. For example, Black women in the United States are more likely to experience complications during pregnancy and childbirth and have higher rates of maternal mortality than women of other races and ethnicities. Women who live in poverty or have limited access to resources may have a more difficult time accessing quality care, which can increase the risk for complications during pregnancy and childbirth. And different cultural norms and expectations can affect how women experience pregnancy and childbirth. For example, some cultures may prioritize home births or traditional birth attendants, while others may prioritize medical interventions and hospital births. And when it comes to family and social support, the level of support and resources that a woman has from her family and social network can also affect her pregnancy and childbirth experience. For example, women with strong social support may have better mental health outcomes and may be more likely to breastfeed. When it comes to South Sudan, there are several social and cultural factors that can also affect women in this country. Traditional cultural practices can play a significant role in how women experience pregnancy and childbirth in South Sudan. For example, some cultures may prioritize home births or traditional birth attendants, just like in the U.S. Limited access to healthcare. In South Sudan, many women have limited access to healthcare facilities and providers, especially in rural areas. This can make it more difficult for them to even access prenatal care and emergency medical services during childbirth. Traditional gender roles may affect how women are treated during pregnancy and childbirth. Women may experience to prioritize the needs of their family or community over their own health and well-being, even while being pregnant. Early marriage and childbirthing. In South Sudan, early marriage and childbearing are common, which can increase the risk for complications during pregnancy and childbirth. Women in South Sudan may face stigma or discrimination related to their pregnancy or childbirth experiences, such as judgment for giving birth at a certain age or for having a medical condition that affects their pregnancy. It is important for healthcare providers and communities to be aware of these social and cultural factors and to provide culturally sensitive and individualized care to each woman. This can help to improve the overall pregnancy and childbirth experience, reduce the risk of complications, and promote the health and well-being of mother and baby. Efforts to improve access to healthcare and to address the root cause of social and cultural factors that can affect women's health and well-being are also important in improving maternal health in South Sudan. Women's representation in government. As of 2023, women's representation in government in the U.S. has continued to increase, but there is still significant room for improvement. In the 117th Congress, which was seated in January 2021, there are a record number of women serving in both the House of Representatives and the Senate. There are 143 women serving in the House of Rep, which is the largest number in the U.S. history, and 24 women serving in the Senate. In addition, Kamala Harris made history in 2021 by becoming the first woman, first Black person, and first person of Indian descent to be elected Vice President of the United States. Despite these gains, women still make up only 27% of the U.S. Congress, with women of color and LGBTQ women being underrepresented. Women also face additional barriers to political representation, including gender biases and stereotypes, the high cost of political campaigns, and the lack of support for women candidates from political parties and other political organizations. Efforts to increase women's representation in government are ongoing, with organizations and initiatives working to recruit and support women candidates, increase voter turnout among women, and address the root cause of gender inequality in politics. When it comes to South Sudan, it is a country that has only recently gained independence, and its political landscape is still developing. Women's representation in government in South Sudan is very low, with women holding only about 5% of seats in the National Legislative Assembly. This low representation of women in government in South Sudan can be attributed to a number of factors, including traditional gender roles, cultural practices that limit women's participation in public life, and lack of education and resources for women. Efforts to increase women's representation in government in South Sudan are ongoing. Women's organizations and advocacy groups are working to address the root causes of gender inequality in politics and to increase women's access to education and resources. The South Sudanese government has also made some efforts to increase women's representation, including setting a 25% quota for women's representation in government and appointing women to some key positions in the government. However, progress has been made slow, and there is still a long way to go to achieve gender parity in government in South Sudan. So I'm going to name a couple local and global organizations from both countries. In South Sudan, there's the South Sudan's Women's Empowerment Network, and it is a local organization that works to promote women's empowerment in South Sudan. The organization focuses on education and training, economic empowerment, and advocacy for women's rights. The program includes providing vocational training, business support, and advocacy for gender equality. There's also the Women for Women International, which is a global organization that works to support women in conflict-affected countries. In South Sudan, Women for Women provides women with access to education, job training, and financial assistance to help them rebuild their lives and support their families. There's the United Nations for Women, which is for gender equality and women's empowerment, and it is active in South Sudan, working to promote gender equality and women's rights. The UN Women's Program in South Sudan includes supporting women's participation in politics and decision-making, promoting economic empowerment, and combating gender-based violence. A couple examples for the United States are the National Organization for Women, which is the largest organization of feminine activists in the United States with over 500,000 members and 550 chapters. This focuses on a range of issues, including reproductive rights, ending gender-based violence, promoting workplace equality, and advocating for LGBTQ+ rights. There's also a presence of UN Women in the United States, which works to promote gender equality and women's rights. And the organization promotes programs in the U.S. focus on issues such as gender-based violence, economic empowerment, and political participation. Another one I wanted to name was Planned Parenthood. It is a reproductive healthcare organization that provides a wide range of healthcare services, including birth control, STI testing and treatment, and abortion care. The organization also advocates for reproductive rights and healthcare access for all individuals. There's also the American Association of University Women, which is a national organization that promotes equity and education for women and girls. The organization's program focuses on leadership development, gender equity, and education in the workplace, and combating gender-based violence. To summarize my presentation on childbirth in both these countries, in the United States, women face numerous issues related to childbirth, including high C-section rates, lack of access to midwifery care, racial disparities in maternal health, inadequate insurance coverage, and obstetric violence. While in Sudan, women face numerous challenges related to childbirth, including lack of access to health care, high mortality rate. To summarize my presentation on childbirth in both these countries, in the United States, women face numerous issues related to childbirth, including high C-section rates, lack of access to midwifery care, racial disparities in maternal health, inadequate insurance coverage, and obstetric violence. While in Sudan, women face numerous challenges related to childbirth, including lack of access to health care, high mortality rate, lack of emergency obstetric care, cultural beliefs, and conflict within the country. Women in both these countries do deserve better for the future and for their children, and for future mothers as well. And on both these slides are my references.